Okay, hi, we're Group 7. We're going to be talking about the profession of a CRNA. I'm Jessica Sykes, and I'll be talking about the role the role that was selected, why it interests us, some of the statistics and references behind the profession of a CRNA.
I'm Sherelle Jones. I'll be discussing the major responsibilities, standards of care for a CRNA, as well as inform you about professional organizations.
My name is Daniel. I'm going to be reviewing the qualifications and requirements to become a CRNA, as well as healthcare reform.
My name is Brandon Watson. I'm going to be going over the impact of this role within the nursing profession regarding nursing shortages.
I'm going to be introducing you to the profession of CRNA. A CRNA is a certified registered nurse anesthetist. They have been around for more than 150 years. They actually were the first nurses to assist with wounded soldiers during the Civil War. The actual existence of CRNAs came into effect in 1956. So that shows you that there's always been a need for nurses in this role, especially as a nurse administering anesthesia. See. CRNAs are professionals that administer more than 40 million anesthetics a year. So this also shows you that there's a need for this in rural areas more than in your average cities for nurses to administer anesthesia. CRNAs are able to practice in all kinds of settings. They practice in hospitals, they can practice with dentists. There's a wide variety of what they can do. So this shows you how nursing as a whole profession has grown, and nurses have the abilities to practice in different areas. So it's a pretty amazing field to be in as a CRNA to have started as a nurse. Okay, let's talk about the role of a CRNA. When you think of a nurse, you don't immediately think of nurses being the ones that are responsible for putting patients to sleep. You think of an anesthesiologist. He's an actual doctor that's gone to school many years to get the licensure to put patients to sleep. But CRNAs have emerged themselves as nurses that are just as capable as anesthesiologists to handle this task. Times have greatly changed, with that being said, with the way anesthesia is being administered. Nurses, the CRNAs, have the ability to practice supervised or unsupervised. There are actual states and laws in certain states that state this. In most states, CRNAs are actually able to practice by themselves. So they don't need any supervision when they're in their procedures and operating rooms within surgeries. They can be there all by themselves. This is because of the amount of education that they have behind them that they are capable to do this without supervision. CRNAs are responsible for managing and monitoring patients' pain levels and vital functions during medical procedures and surgeries. Some of their responsibilities are assessing patients when they are sedated and how patients respond to anesthesia. And if an emergency comes up, they are able to handle it quickly and professionally with the tools that they have at hand. CRNAs are also supposed to be able to calculate dosages quickly and precisely for whichever procedures that they have going on. They are also able to communicate with patients before, during, and after administering anesthesia. Why the role of a CRNA has interested us. Not everybody can handle the role of a CRNA. They perform procedures, not actual procedures, but they administer anesthesia under very critical, happenings at times. It's not always a very easy, simple things. There's a lot of emergency procedures. They're on call a lot of times, so they have to come in sometimes with very little sleep and be able to give safe anesthesia administration. They have to be able to remain calm and be controlled in high pressure situations. Along again, they need to have the right mental state to be able to calculate the right dosages for the anesthesia that they are giving. They must also be able to excel in knowing what the procedure the patient is having done so they can explain it to the families before and after the procedure. So this shows that the CRNA, she specializes in anesthesia, but she still needs to have a well-grounded background of medicine to what patients are actually going through outside of anesthesia itself. CRNAs are well respected. They are respected because of the amount of knowledge that they hold in regard to administering anesthesia. At one point, these nurses were passing medications at the bedside like many other nurses, and they have taken the time to pursue higher education, and now they are administering anesthesia. That's pretty amazing, and it makes me proud to be part of the profession as a nurse. I'm going to talk about some of the statistics and the references that support the needs for CRNAs in the world of anesthesia administration. There is a rapid demand for CRNAs. Hospitals are opting to employ a single CRNA instead of a high-cost anesthesiologist, especially in more of the rural areas where anesthesia needs to be administered. There is a high demand in this field, as I had just said, as they are choosing them over anesthesiologists. With that being said, this is a very marketable field to become a CRNA. There are some statistics that show that there were only 35,000 CRNAs that actually graduated and that are actually able to practice anesthesia administration versus around 2 million registered nurses that graduated. That shows you that registered nurses are not actually pursuing higher education as they should. It's always a good idea to pursue higher education, but that is actually not being done. There's a huge difference, and there will continue to be a huge difference. Another statistic showed from 2012 looking forward to 2022, there only shows a 25% jump in CRNAs that are coming out and actually able to participate in anesthesia administration. The CRNA, they make around $160,000 a year, which is great money, but the money doesn't mean everything. Not everybody's able to go into this field, and it shouldn't just be because of money. CRNAs need to be able to practice under pressure. They need to be able to know the right calculations because they are dealing with people's lives. Nurses in general always deal with people's lives, but nurse aestheticists have to have the practice, the skill, and the knowledge to be masters at their trade.
My name is Daniel, and I'm going to be talking about the education, certification, and licensure requirements. To become a CNA, first you need to have your associate's degree in nursing and your bachelor's degree in nursing. Both of those will deal with health assessment, physiology, chemistry. The BSN is a 4-year degree. On top of that, to become a CRNA, you need to take a 3-year 66 course or credit hour program, which will deal with advanced physiology, pharmacology. Certifications that you need to have are a current ACLS CAR certification, a current PAL certification, and a current BLS certification. As far as nurse anesthetist role in healthcare reform, using a nurse anesthetist to provide anesthesia to patients in surgical situations, dental, and other professions will allow for less cost to the patient. It roughly costs about $158,000 for a nurse anesthetist to do a assist with a procedure versus using an anesthesiologist. It costs about 4 times that rate at about $410,000.
Hi, so now we'll talk about the job responsibilities for a CRNA. It's pretty self-explanatory. First and foremost, the CRNA must complete a pre-anesthesia assessment. Um, that's basically to ensure that the patient has never had a reaction to the medications that are intended for use, and to obtain the consent. Next, the CRNA is to prepare the patient for the anesthesia to be rendered, and that pretty much details positioning. For example, for an epidural, usually the patient is they're going to be sitting up on the side of the bed, leaning slightly forward, so the CRNA can feel for the area that they need to go into. So that's a part of preparing the patient for anesthesia. Next, the CRNA administers the anesthesia and then maintains it. They're constantly monitoring vitals, and they're constantly making changes appropriately. This is the most critical part of the CRNA's job, because you don't want a situation where there's anesthesia awareness. Anesthesia awareness is where the patient is still under the paralytic, but they're no longer sedated. They're completely conscious, and they can feel everything, but they can't move, and they can't speak. They can't tell you that they're in pain. They can't tell you they're in a lot of pain. So the CRNA's role is to watch for changes in the vital signs, things of that nature, to make sure that the appropriate level of sedation is still there. Um, Finally, once the procedure or surgery is done, the CRNA's responsibility is to report and transfer care to either a PACU nurse or another anesthesiologist or another CRNA. So those are the primary responsibilities for a CRNA. They're pretty self-explanatory. There's a lot of monitoring involved. The standards in place for nurse anesthesia practice are set to serve as a guide for CRNAs and healthcare institutions. These standards are in place to assist the profession in evaluating the quality of care. They're in place to serve as a common ground for practitioners to develop their skills. They're in place to assist the public in understanding what to expect from a CRNA. And then finally, they're in place to support and protect the basic rights of a patient. These standards, of course, can be exceeded at any time by a CRNA, and it's often encouraged that a CRNA find ways to integrate technology into their practice. But there are times when a CRNA may have to deviate from the standards of care, meaning, for example, if there's an emergency situation, they're not always able to obtain consent, but they still need to provide that care to the patient. But as a whole, the standards are in place to help provide high quality care, and that's the main focus of these standards that are set in place by the American Association of Nurse Anesthetists. So I wanted to go a little deeper into the standards of care. There's a total of 11 that are in place, and I broke them down into preoperative and intraoperative. Preoperatively, we have standards 1, 2, and 3, which is basically to get you to do your assessment, to obtain the consent, and to develop the plan. Standards 4 and 5 goes into the operation or procedure taking place. First, there's the implementation and the adjustment of the anesthesia. The CRNA is going to intervene as required based on signs and symptoms of like the vital changes in the vital signs, things like that. And standard 5 has to deal with monitoring the patient, constantly monitoring the patient while they're in surgery. They're looking at the oxygenation status, the ventilation status, cardiovascular, thermoregulation, neuromuscular, and of course, positioning. So standards 6 through 9 details like the end phases of during a procedure intraoperatively. Um, Intraoperatively, there's a lot of documenting and charting that a CRNA has to do. They have to constantly, like I said, monitor and document and chart the essentials that may be reviewed later on. Um, Now, once the procedure is over, standard 7 is where the um, CRNA has to evaluate the patient and determine if it's safe to transfer care, be it to another PACU nurse or another CRNA. And once again, they have to report the essentials, things that happened during the procedure, if anything did. Um, so getting out of a procedure, getting out of a surgery, overall, the CRNA needs to adhere to safety precautions. They need to be able to monitor their equipment to decrease the risk for fire, explosions, electrical shock. There's a lot of equipment that they're in charge of, so we want to make sure there's no malfunctions or anything like that. And then most importantly, they want to adhere to infection protocols set by the hospital as an organization. And lastly, we have standards 10 through 11. And this is just a general, this just applies generally to CRNA practice as a whole. Uh, like I said, there's an ongoing review and evaluation of the practice in general. Um, CRNAs are constantly doing review to develop their skills and improve their skills and develop new skills. So there's just, like I said, a constant ongoing review, as with nursing as a whole. And then, of course, there's a respect and maintenance of the patient's basic rights. Respect, maintain, and support.
Hello, I'm Brandon, and I'm talking about the impact role of CRNAs regarding nursing shortage. Uh, the present statistics right now show that there are about 40,000 CRNAs out of about 2 million, give or take, registered nurses, and that presents a shortage. So now we're going to talk about supply and demand. The demand for CRNAs is really high due to increasing technology, as well as coupled with a higher population of elderly people, and a lot of people in rural areas not really being able to have access to the higher level of care that would be provided by anesthesiologists and CRNAs. It's really hard for rural areas to pull these CRNAs from metropolitan areas to want to work in those areas. So there's a shortage in rural areas. There's not so much of a shortage in metropolitan areas, and that's the reason. That's the reason why the rural areas are lacking a bit, because it's kind of hard to tempt people to want to go to those areas and work, as well as it being an overall shortage of CRNAs in the country. So we're going to talk about the future needs of CRNAs. There's kind of two theories about this. One of them states that the the demand market is going to stay the same for CRNAs. There's still going to be a high demand up until about 2020. That's where this study was done through the RAND group, RAND Health. They believe that by 2020, the amount of people needing access to CRNAs is just going to increase. So it's still going to be a shortage of CRNAs going into 2020. There's, however, another opinion that believes that the supply of CRNAs is going to increase at a rate of about 3% annually, and that's going to create about 8,000 more CRNAs than the market actually needs. So we already talked about the surplus and a shortage. Right now, I'm going to go over some states in the country that are pretty significant shortages going on in CRNAs. Also, I'll talk about states that have a surplus. States like Louisiana, North Carolina, Alabama, North Dakota, Delaware, they're all experiencing shortages of CRNAs. States that are not really experiencing shortages, states that have a surplus of CRNAs are Nevada, states like Washington, Nevada, Arizona, Oregon, um, Idaho, places like that are not really experiencing shortages. But keep in mind, just because I'm mentioning the states that have shortages and surpluses, there's still rural areas, even within these states, that have surpluses of CRNAs that still are experiencing shortages in their rural areas. So we'll keep that in mind.